Hello, Doctor. Welcome to DC Conversations. Thank you for agreeing to do this interview. I've always heard that if you're very tired and if you have a very hectic lifestyle, you tend to feel sleepy, and it's easy for you to get sleep when you exercise too much and all that. Why is it that despite the fact that a lot of people are fitness conscious and they're also working out, and at the same time they have a very busy lifestyle, yet there's a lot of complaints about sleep disorders?
See, first of all, there are different types of sleep disorders. So right now, why? Because we are seeing a lot of urbanized, globalized work culture, like night shifts, morning shifts, and excessive alcohol intake, partying, hectic schedules because of lot of stress. All these factors are playing a major role, and most importantly, the lifestyle. Because of the
Mm.
junk foods and everything, people are developing obesity. Especially if you see, when you take the comparative study from the United States, almost 40% of the school children, 40 to 50% of the school children are having obesity.
Mm.
So that is a big number. So because of the obesity, or obesity is one of the major risk factor for sleep disorders, sleep apneas, and all these things. So how they are identifying is because of the reduced functioning and excessive daytime sleepiness, fatigue. All these symptoms are making them to realize that they are suffering from some other issue. So that is where they are turn out to the doctors.
Yeah. So, what are the major sleeping disorders in today's age?
Okay. When it comes to the sleeping disorders, most commonest is sleep apnea. Obstructive sleep apnea is one of the thing which is very common,
Mm.
and insomnia. Insomnia is persons who will not sleep at all,
Mm.
and in obstructive sleep apnea, because of the obstruction of the upper airways, they develop this obstructive sleep apnea.
Mm.
Next is central sleep apnea. Central sleep apnea is a neurological disorder where they tend to sleep a lot.
Mm.
Okay. Next thing comes to narcolepsy. Okay, narcolepsy, it is also a type of neurological condition. So the brain will signal the body, so which will cause them more excessive daytime sleepiness. And next, it comes to parasomnias. Parasomnias are nothing but you might have heard this daytime sleepiness, night sleepwalking, somnambulism,
Yeah,
sleepwalking.
yeah, somnambulism.
Uh,
Yeah,
they talk in the sleep.
yeah.
Yeah, yeah. So they talk in the sleep as well. These are the things which we see a lot. And also the circadian rhythm, sleep cycle issues. So this is more common in people who are doing day and night shifts. Sometimes they do the night shift. After 3 days, they again do the day shift. So the
Yeah.
brain will not know when is the day, when is the night. So
Mm.
that circadian rhythm, the biological clock issues will also lead to this problem. So that is one. That is one of the very commonest thing where software individuals, we see this in software individuals, and parasomnias are more common in post-traumatic stress disorders or sleep deprivation, where we see this thing. These are the quite common things. And coming to the uncommonest things, restless leg syndrome. Restless leg syndrome is during the sleep, they continuously move their limbs. They have the urge to move the limbs, and they will not have proper sleep. These are
Mm.
the commonest sleep disorders what we come across in day-to-day activities. Day-to-day.
Why does this happen? I mean, why do people talk in their sleep?
See, one, because of the post-traumatic stress. So when suppose if they are having they gone through major surgeries or major accidents, or suppose someone bereavement, someone lost their loved ones, and This is one of the thing, and one more thing is sleep deprivation. All these things lead to the brain. Even during the sleep, brain will continuously function. So brain will not go to the last step of the sleep.
Mm.
So it will continuously think. So their thoughts will make them disturb.
Yeah. So what causes snoring? Snoring is also one of the sleep disorders, right? I mean, people don't sleep; they're always snoring.
So snoring is the most commonest problem, most commonest symptom. Snoring, see, so airways will be like tube-like thing. Okay. So this is a major airway. So trachea. So when they lie down, the trachea, the airway will be compressed.
Mm.
Because of the compression in the airways, upper airway, normal mechanism of our nose is we breathe in from our nose and breathe out from our nose. There, we take all the dry air and the air will be humidified by the sinuses.
Mm.
Sinuses are the small pockets behind our nose.
Mm.
Then again, the air will pass through the trachea to the airways to the lungs. That's how the mechanism is. So the problem, what will happen is this because of the nasal congestion, because of the upper airway obstruction, because of the obesity and all these things, the air what we breathe from our nose is not adequate for the lungs. So we tend to breathe from our mouth,
Yeah.
keeping our mouth open because the pressure what we take from our nose is not sufficient. So we open our mouth and we breathe in. So with the air going inside the airways, because of the turbulence and the vibration of the airways, we get the snoring. We get the sound like snore. So that is the mechanism behind the snoring. So again, the snoring is different. Snoring is a symptom of sleep apnea.
Mm.
Not all snorings are sleep apnea,
Mm.
and not all the patients of sleep apnea will snore. This is the thing.
Okay. But but snoring could affect people of all ages, right? And also, it's a kind of it is also disturbing the sleep of the family members. So, what are some of the measures to prevent snoring? Is it permanent, or people can actually work on them to reduce snoring?
Absolutely, you are right. So it will obviously disturb the spouse or family member sleep. So the it can occur in any age, even in the children of 5 to 6 or 7, 8, 10 years. Children also we see snoring. Why? Because of the adenoids. So we need to know the reason behind the snoring.
Mm.
So most commonly upper airway obstruction. In children, we see adenoids, tonsillitis, all these things will lead to the snoring. So if these problems are corrected, then snoring will settle down. If the snoring is there in the children, this is how we manage. We rule out the pathology like adenoids. Adenoids are the small glands which are present behind the nose. So
Mm.
if they are swollen, the nose is obviously having the obstruction. So again, they breathe from the mouth. Next thing is tonsillitis. Generally, adenoids and tonsils both go hand in hand. They are like best friends, we can say. So
Mm.
when they have adenoids, they will have tonsillitis, tonsils as well. So the nose is obstructed and the mouth is obstructed. So the children will snore. Once the insult to the airways is removed, surgically corrected, then also it will settle down.
Okay.
Again, coming to the adult onset, when you take snoring in the adults, snoring can be seen in lean individuals, obese individuals.
Mm.
So, in lean individuals, we should always rule out upper airway obstruction like tonsillitis, nasal congestion, nasal allergies, elongated uvula. Base of some people will have the tongue base is quite thick enough. So, when they lie down, the tongue will be closing the airways. That
Mm.
will also lead to the snoring and sudden choking episodes will also be seen. So we have to rule out whether the snoring is caused by the upper airway obstruction or because of the neurological thing or because of the only nasal congestion. Even allergies can also lead to snoring. People who sneeze a lot, who are having allergic rhinitis, sinusitis, they can also snore. because of the nasal function is being closed. They are using their mouth. So that's how also we can see the snoring. These all are correctable. We can use simple nasal decongestants to relieve the congestion between the nostrils.
Mm,
Next, coming to the sleep apnea. Generally, patients who are having sleep apnea will be obese, quite
mm,
obese. So the abdominal fat will be compressing the lung parenchyma, lungs also. So the lungs will be moving up. Again, upper airway obstruction is also there. So these two things will cause more problem. So now, how do we diagnose? How do we differentiate snoring to sleep apnea? Is uh, in snoring they only snore. They
mm,
will not have sudden choking.
mm,
Whereas sleep apnea, see, every individual while sleeping, they might have 0 to 5 episodes of sudden reduction in oxygenation. So they move from one position to another position. 0 to 5, we call that as apnea hypopnea index. So
mm,
0 to 5 is normal. So people who are having more than 5 to 15, we call that as mild. More than 15, we call that as moderate. More than 25, we call that as severe.
mm,
So a person who snore, who is having sudden cessation of air or sudden choking episodes, that can be considered as sleep apnea. Their further evaluation is mandatory. Symptoms of sleep apnea patients is they have excessive daytime sleepiness, fatigue, and fatigue. They will have concentration deficiency. They might not focus properly.
mm.
And pre-diabetes, they develop, if it is not diagnosed on time, they will develop diabetes, hypertension, stroke, cardiovascular problems. All these problems, they have increased risk of developing these problems.
But for a person, who is actually sleeping next to a person who snores a lot, people
Hmm.
often say don't, wake them up suddenly. It could shock them and all that. So is there anything that people should know when, they have sleeping partners who snore?
Okay, and this is one of the biggest risk factor for in US, in the developed countries. The diverse rate is more in people who are having sleep apnea or snoring. So
Mm,
it can be corrected. There are multiple ways to correct, provided if it is diagnosed properly. Suppose sometimes the tongue, base of the tongue is more. There we can use the maxillary protrusion devices where it will keep the tongue open.
mm,
In some people, nasal congestion and DNS, deviated nasal septum, it can also be corrected surgically. So people who suppose the spouses who are suffering with the sleep, obviously, when the husband or wife snores, the spouse will have disturbed sleep,
mm,
leading to reduced activity in the following day, anger issues, and mood disorders, all the headaches, all these things will come.
mm,
So, ideal way to settle down this issue is you can move the person when he snores. With the movement also, the snoring will come down. Suppose if any person, position of the sleep is very important. If they lie down flat on their back by seeing the roof, the snoring will be more.
okay.
Snoring will be more because here the muscles will be relaxed. The tone of the muscle will be relaxed. So when they sleep in that position, the relaxed muscles will obstruct the airways. So when
Mm,
they turn right side, left side, or in supine position, completely turning back, sleeping on the belly,
mm,
these positions will reduce the snoring as well.
okay. Okay.
One more thing, what they can do is they can do steam inhalation or simple nasal decongestants. These things will also help in reducing the snoring.
Okay. Any lifestyle changes required to, actually get rid of any kind of sleep disorder, not just snoring?
One thing is always maintaining proper sleep schedule.
Mm,
So if you are sleeping at 10:30, try to sleep at 10:30
mm,
and try to wake at 6 o'clock. Please wake up at 6 o'clock. If you disturb your sleep cycle, then you will tend to have more sleep related problems.
yeah.
Uh, Next thing is avoiding junk food, maintaining fitness, walking, jogging, or aerobic exercises or weightlifting, anything will also help in improving the maintaining the muscle tone and reducing the risk of obesity as well. So proper lifestyle, physical exercises, good food intake, timely food intake, frequent meals, avoiding heavy meals, avoiding alcohol, avoiding cigarettes. All these things will help in reducing the risk to the sleep apnea.
Okay. Thank you, doctor. Thank you so much for talking to us. Thank you.
Thank you.